And now a view from our comprehensive physician, Dr. Morse.
I want to thank you, Dr. Grover, and the AAMC for having me today. I have to say, congratulations to those who matched. I don't think you let them sweat long enough, personally, before they opened the envelope. It's an honor and a privilege to be here today to tell you my personal story about why I became a doctor, and specifically why I became a primary care doctor. Every doctor is going to have their own story as to why they went into medicine. And I found over the years that the reasons physicians go into medicine are very multifaceted and more complex than most people would think. In my case, the choice to become a primary care doctor was a circuitous decision process influenced by experiences in my upbringing, influential mentors, personal lifestyle choices, and ultimately consideration of what type of relationship I wanted to have with my patients. So I would describe my childhood as fairly eclectic. My mom was a self-made photographer, and my dad was a mathematician turned geophysicist. And at the age of 11, because of my dad's job, we moved from a small town in Texas to Bogota, Colombia. And over the next 20 years, we would proceed to move from Nigeria to Indonesia, Indonesia to Kazakhstan, Kazakhstan back to Nigeria. And I was with my family for the first few years of this adventure, and eventually I moved to a small town outside of Boston to finish high school at boarding school. And that move from West Africa with my family back to the US to a small prep school community was a very shocking re-entry. And it was the first time that I realized and became acutely aware of the social and health disparities that existed in the world. I didn't quite have the answers to all the questions that were in my head, but I started trying to figure out where my place was in this larger picture, and I developed an awareness of the human condition from that point on. Every time I went to visit my parents, I was reminded how fortunate we were to have electricity and running water and grocery stores and access to doctors. Other than this experience and the fact that I communicated with my parents as a teenager via fax machine, I had a relatively normal high school experience, and I hung out with my friends, I loved science, I played sports. So fast forward to college. I graduated from Brown in 2001 with a degree in biology, but I wasn't quite sure what I wanted to do with my life, so I did what any rational college graduate with an education did, and I crashed with my sister in her studio apartment in New York City. I worked for a few years in random jobs and figured out what I didn't want to do in life. And then in 2004, I was lucky enough to land a job at Memorial Sloan Kettering Cancer Center. Sloan Kettering was really where that awareness of the human condition came to life in me. It's where I had my first experiences working with patients. I became privy to their most intimate bodily functions, and I was often present in the clinic room when the patients with their families came face to face with their own mortality. This job, I realized very quickly, was not for the faint of heart. I worked with some of the most dedicated, highly specialized medical and surgical oncologists in the field there. Their hours were long, the pace was maddening, and the patients were very sick. One of the most memorable pieces of advice that I received regarding the process of becoming a doctor was from a hepatobiliary surgeon with whom I worked. He said, "Meroë, becoming a doctor is a marathon, it's not a sprint. You have to learn to pace yourself and push through the hardest parts." These doctors kept both a tireless drive and an enthusiasm for what they did that I had never seen before. So it was at Sloan Kettering where I took the leap, both personally and financially, to pursue a degree in medicine. By the end of my first year there, I was enrolled in evening classes at Columbia University's Postbaccalaureate Pre-Medical Program. It's a 2-year program. And by the time I completed my pre-medical coursework and applied to medical school, I was pretty certain about my calling. I wanted to be a primary care doctor. After witnessing the great lengths that many of my patients went through in order to obtain medical care, they mortgaged their houses and they underwent extreme medical treatments. I wanted to be an advocate for them while they had to navigate the complexities of our healthcare system. I wanted to intercept my patients with preventative medicine before they developed illnesses, and for those who already had diagnoses, I wanted to slow the disease process down and try to reduce the burden of their illness in life. I also wanted to cultivate lasting relationships with my patients. So in 2007, I moved to Louisiana to attend Tulane University School of Medicine. During my 4 years there, I had the fortune of working with impassioned physicians who, in the wake of Katrina, were trying to piece together their broken medical system. From the health disparities I observed, they reminded me a lot of the experiences that I had seen living abroad. And initially, I naively thought, well, this is America. How can this be taking place? My experience in New Orleans furthered my resolve to practice primary care medicine and also find a way to improve the delivery of United States healthcare. In my 4th year of medical school, I listed in order of preference the primary care internal medicine programs in the order that I wished to train, and I submitted this list for the match. So I was in the position you were in about 20 minutes ago. A lot more nervous though. My husband had an established career in New Orleans at the time, and we made our match list together, but I just want to reiterate that the physician process affects more than just the medical student. There are families involved in it. So in March 2011, I was fortunate enough to match to my first residency selection, New York University's Primary Care Internal Medicine program, which is based out of Bellevue Hospital Center. Bellevue is the oldest public hospital in the United States and has an extremely diverse patient population. To give you a sense of the diversity of our patients, we offer language interpreter services for over 120 languages and dialects, and we use those on a regular basis. Throughout my residency, I rotated through Bellevue, through the Manhattan VA, and through Tisch, which is our private hospital. I also hold a primary care clinic at Bellevue and at Gouverneur, which is a patient-centered medical home in the Lower East Side of Manhattan. So within these hospitals and within the clinics, I've been able to follow the progress of my patients throughout the 3 years and really reap the benefits of having a lasting patient relationship. Many of my patients endured hardship and adversity to get to where they are, and it's their gratitude for my care that really makes this job worth doing. I have a brief story about a patient of mine that I wanted to share with you. I met her in February, and her story is one of many that I keep close to my heart to remind me why I work long hours and why I do this job. She's 39, and for most of her life she has suffered from pretty severe endometriosis, which, for those of you who don't know, is a disease affecting the uterine lining. It causes a lot of pelvic pain and can be very debilitating and cause infertility. Prior to seeing me, she had undergone multiple surgeries to try to relieve this problem, and ultimately she underwent a very strong medical treatment, which cured her of her pain, but left her with a lot of significant muscle and bone pain. So she came to me for a primary care doctor, and as I met her, she was sitting next to me. I could tell that she was very burdened by her illness. She was suffering, and she said to me that she didn't go a day without thinking about her pain. And in this clinic visit, I let her speak. She spoke for the majority of the 20 minutes. I did a physical exam and sat with her, and we developed an approach to try to at least reduce a little bit of her pain. My recommendations were to give her a long-acting anti-inflammatory and to go up on her antidepressant, because it's known that pain is magnified in the setting of uncontrolled depression. I also referred her to physical therapy because there's new data that shows physical activity is great for chronic pain syndrome. And most importantly, I set her up with an appointment within a month, and I gave her my contact information. Patients having access to their doctor, knowing that they can get in touch with us when they need, relieves a lot of anxiety. So a month later, I go to bring in Miss A into the clinic, and I'll be honest, I was concerned that her pain and anxiety still existed. And when I called her over, she walked towards me and gave me a very big smile, and I noticed that she wasn't using the pain that she had used on our first visit. So she sat down and told me she'd been doing physical therapy, and she was taking the long-acting anti-inflammatory, and she'd gone up on the antidepressant, and they were making a difference. And then she said to me, "Dr. Morse, I feel great, and I'm so happy that I met you." And those words meant the world to me. From a purely medical perspective, the interventions that I suggested were very simple, not complicated at all. But when combined with a trusting doctor-patient relationship, the effects can be very therapeutic. So this July, I complete my residency training, and I'll enter the practice of medicine, confident enough to care for a fairly critically ill and socially complex patient population. My husband and I are moving to Houston, Texas, and I'll be teaching primary care medicine at the DeBakey VA, working with Baylor and University of Texas, Houston residents. Of course, it'll be hard to leave my patients in New York, and it'll certainly be a challenge to develop a new patient panel with my veterans. But I feel optimistic about this, and I have the tools that my training program has provided with me. The learning curve will be very steep, and I have to say that I'm not quite convinced that the marathon is yet over, despite what that surgeon told me. But I keep close at hand the words of Theodore Roosevelt, who, in his Labor Day speech in 1903, observed, "Far and away the best prize that life offers is the chance to work hard at work worth doing." Thank you.